5 set of instruments. First set of instrument is hand instruments, which will be in our hand. These all are hand instrument. Hand instrument is also of two type. One is reusable, another is disposable. So that also we will learn all the reusable as well as disposable. Today in front of us these are reusable instrument. Tomorrow I am going to discuss the disposable instrument also. So the first set of instrument is hand instrument. Second set of instrument is optical instrument, that consists of telescope, head of the camera and monitor. Another is light emitting instrument, that is different type of light sources and light cable. That is third set of instrument. Fourth set of instrument is insufflation instruments, that is different capacity and type of insufflator, the tubings and different type of gas cylinder, different type of gas which is used. And the last set of instrument is energy sources, like the different type of energy like the monopolar, bipolar, harmonic, ligasior, and we have NCL, thunderbeat, laser, hydrodissection, and all the advanced this technology I have to discuss. Without knowing this, you will not be able to decide that uterine artery is better to do by harmonic or NCL or ligasior. What is the technology behind, which temperature is required to seal, which temperature and frequency is required to cut. So, those are instrument design section will cover it. So, the first instrument in hand instrument, in front of me these instruments are called as access instrument. Access means entry inside the abdomen, and in front of all of you these are operating instruments that will be done to operate. In front of me these are various little trocar, cannulas, these are for access. You know, before starting laparoscopy, we should learn that laparoscopy has three important pillars. If you want to become a good laparoscopic surgeon, then you have to put 3 disciplines in your life. First is ergonomics, second is task analysis, and third is engineering. These are the 3 important. Any one if you are missing, you are not a complete laparoscopic surgeon. These are the 3 pillars, and then you can put anything over and you can put it like that, and then it will be stable. If any of them is broken, it will fall. What is ergonomics? Ergonomics, what is the definition of ergonomics? Anybody? Please tell. Yes? Instruments? Yes, to improve the task performance. Very good. So, ergonomics means interface between man and machine scientifically to improve the task performance, so that we can work better. This is the meaning of ergo means work, ergonomics means law of work. Without ergonomics you cannot do the surgery better, and laparoscopy is full of ergonomics. Do you know, if you are seeing someone is doing good surgery and someone is doing bad, only difference is that one who is doing good, he knows ergonomics, and one who is not good does not know the ergonomics. Just like suppose there is accident of a car. Whenever 2 cars they get accident, only the people who are in the cheaper car they get killed. If a BMW and Maruti will come at a 120 km speed and it will collide, people in the BMW will not die, it is guaranteed, but people in the Maruti they will die. Reason being, it is ergonomically designed to safety. It has a airbag, it has a anti-collision body, and it has a collision absorbent chassis which will absorb it, and people then will not die. You are seeing every day in the news that BMW has killed 5 people, but driver has escaped. He was not killed. He was saved. Reason being, whatever later will happen nobody knows, but why? Because of ergonomics, nothing else. So, anything happens in accident, this news, and if a big car company, if you will go to the USA, in the showroom of Rolls Royce, Bentley, Ferrari, Lamborghini, then they never advertise their car by the help of celebrities. No celebrities is advertising Bentley or Ferrari, they do not advertise, because they think these celebrities are not up to the mark to advertise our car. They advertise it by the accident. If you will go to the New York, the biggest showroom of the car, they have big pictures of the bad accidents. And seeing the condition of those accidents, you will be surprised, oh, what happens to the people, and they will say all are safe. And then you will feel a confidence that I must buy this car, because that much major accident and all the passengers are safe. That means this car can take guarantee of my safety, and that is its own advertisement, and you will buy this. Exactly same way, same news of the accident. Suppose the accident, car was hit and there was some casualty. For the traffic police, it does not matter who has made the car. Once the car has license, they can sell it in the market. They will not go to the Maruti company CMD to arrest that why you made the car like that the people were killed. They cannot do that, because once they have license, they can sell the car. For them, what is their job? That they will correct the ergonomics of the traffic. What they will do, that if repeatedly accident is happening, they will put one red light. They will put one board, notice board writing that accident prone zone. They will write another board that speed limit 40 kilometer, isn't it? So, they are correcting their own ergonomics. Now, for the people who are residing in that area, what they will do? They will think it is very bad, every day accident is happening, one day my family member can be killed. So, they will put a big speed breaker. So, they are changing that ergonomics according to their own wish. They will put a big speed breaker, so that speed should be minimized, and then they are safe. So, everybody is thinking for the government. If they will see that it is not working anyway, then they will put one flyover, or they will put some other or underway, so that two traffic should not clash together and there should be a safety. This is the way how everybody is doing. Exactly same way, once the uterine artery started bleeding, you see do surgery, uterine started bleeding, then we think, oh, uterine is bleeding, this is very bad, so surgery is not good. But we should not see this way. We should exactly try to find out the ergonomics. Where was the problem? Problem may be incorrect timing. Problem may be incorrect setting of the wattage. Problem may be incorrect traction over the tissue. Problem may be the energy source frequency setting itself, and problem may be at the wrong place you are holding the tissue to cook uterines. So, problem is only with the ergonomics, and the day you will understand your ergonomics, these problems will not happen. Just like a simple example, when you enter into the car, first thing what you are adjusting? Your seat. So, your seat should be in the comfortable. Suppose before you, a tall person has drove that car and your height is less, you come there and sit on the same seat, you cannot control the car, because your foot cannot reach to the brake. So, you have to adjust it, then only you can drive it. Exactly same way, once you enter into the operation theatre, first thing you should adjust is the OT table height, and OT table height should be 0.49 into the height of the surgeon. If your height is 1 meter, then OT table should be 49 centimeter from the floor, and same according to, if suppose your height is 150 centimeter, then you will take 68 or 65 centimeter from the floor. Or if you do not want to measure, can I have this instrument? Two instruments, thank you very much. If you do not want to measure, one more, if you do not want to measure, then simply the handle of the instrument should be at the level of elbow. If it is above, you cannot perform, because your arm will be abducted. This angle should never be more than 15 degree, up to here it is allowed. up to 15 degree, up to this you can perform. If this angle between the trunk and the arm is more than 15 degree, then each 5 degree is performing 5% decrease in your efficiency, each 5 degree. And suppose it is 90 degree, and then you are working, after 5 minutes you will say stop surgery, oh I cannot do, because how can you keep the arm at 90 degree? I do not think that if everybody will do like that, after 5 minutes you will get a pain in the deltoid, and then you cannot no more be able to perform. And even if you will perform, your instrument will get tremor, and your ergonomics will be wrong. So, maximum abduction of the arm is required 15 degree maximum, 5 to 10 degree is good, but less than 15 degree. If your handle of the instrument, suppose my height is that much only, then according to this my height, table should be here, so that half instrument in, half instrument out, and then handle is at the level of elbow. Whatever you do in your life, day to day life, you want the elbow, like he is keeping the notebook on the table. Do you know why? So that notebook is at the level of elbow, that is why we use table. Some people, they are keeping their bag on their thigh, so that if they have to write, they can write on keeping the notebook on the bag, so that they bring. If you want to a keyboard, if you want to play a computer or keyboard, you always like that your hand should be at the level of elbow, then your ergonomics is 100% correct. So, this you can only achieve if your OT table is correct. Sometime if your height is less and your OT table is not able to manipulate that much, you have to use one platform, and then you should increase your height, stand on that platform, and then you can perform the procedure. This angle, if it is more than 15 degree, angle between the wrist and the forearm, then also you cannot perform. Like suppose this arm is increasing, this length is increasing from the floor, and if your arm has problem in abduction, then do you know what happens? We decrease this and we bend our hand, because I cannot keep it for a long time. So, I have to decrease it, and then this bend like that. As soon as this angle between the hand and forearm is more than 15 degree, any type of suturing knotting is impossible. You cannot tie any knot, surgeon's knot, Miller's knot, anything. If you will keep your hand like that, even I do not think even in open surgery you will be able to tie your knot. You cannot do that 15 degree. You are always keeping it straight, even in the open surgery. Another important is, so this is just an example of ergonomics. How much the ergonomics is important. Another is coaxial alignment. Coaxial alignment means eye of the surgeon, target of dissection, and the center of monitor should be in the same axis. Like suppose this is appendix. Let us assume this is appendix. This is the head of the patient. This is the foot of the patient, and you are a surgeon. Then you should stand near the opposite shoulder, and the monitor should be kept near the hip of the right side. So, if you are seeing the eye of the surgeon, target of dissection and center of the monitor is in the same axis. This is called as coaxial alignment. If you have a coaxial alignment, then your performance is correct. Suppose you do not have coaxial, suppose you are keeping monitor here and you are standing there, then you have to bend, and as soon as more than 15 degree head tilt is there, your performance is deteriorated more than 25%. Up to 15 degree is okay. Suppose this is coaxial, if I am seeing this is coaxial, that is why he is keeping the camera exactly in front of me for coaxial. But suppose I am seeing up to here, then it is okay, up to 15 degree is fine. But suppose I will keep monitor here and then I am performing the surgery, my cleidomastoid, sternocleidomastoid muscle has a stretch, and as soon as it has a stretch, your performance has to be bad. You cannot do the same way the work. Even if you have to write a letter, you cannot write the letter with the good handwriting. That is why in the exam the people where they do the cheating, their handwriting is not good because their ergonomics is not good. If you put a paper here and then seeing there and writing here, your ergonomics is bad. Your handwriting will go this line, your lines will not be straight, isn't it? If they allow you to keep the notebook in front, that is a good ergonomics, then you can do. So, in front means coaxial alignment. Even in the laptop, even the iPhone, you keep it in front in the coaxial alignment. And if it is coaxial, your ergonomics is good. So, in the OT table, when you are placing for surgery, you have to always stand opposite to the pathology. If the ovarian cyst is left side, you should stand on the right to the patient, which we sometimes not do. In many of the operation theatre, our trolley is fixed, our instrument is fixed, and then we are struggling with the bad ergonomics, because you are not changing your place to do the surgery. You are standing at the one place only, that is bad. Always the surgeon has to stand opposite to the pathology. If you have to do left side hernia surgery, you have to stand near the right shoulder. If right hernia, left shoulder. Gynecologists, they don't do any time that, they always stand on the left. Even if they have to perform left side ovarian cyst, they stand on the left and they are struggling. Another example is distance from the monitor should be 5 times to the diagonal length of the monitor screen. Suppose this is a monitor screen and this is 21 inch in the diameter. Monitor screen diameter means one corner to another corner. This is how they sell the monitor. 21 inch means from one corner to another it is 21 inch. If it is 21 inch monitor, you should sit 105 inch away from this. 5 times means 105, 1 meter and little away. And if it is 14 inch monitor, you should stand 70 inch away, 5 times. Then you have the better resolution. Do you know why? We see only good if the image comes over our macula. Macula is the central location of the retina, where we have the maximum number of cones, and cones, rod and cones are there. Cones are responsible for color perception and resolution. Rods can only give you black and white and the impression. So, cones are very important, and cones are in the central location. And suppose this is a monitor and it is far away from me. Right now it is approximately 3 meters away from me. And if I will see that monitor and then perform the laparoscopy, then I cannot see the cystic duct CBD better or uterine artery better. Do you know why? On my macula, that screen is not only coming, many things are coming. Her face is also coming, this wall is also coming, this ceiling is also coming, and this table is also coming. So, my eye will try to make a focus for all of them as a mean focal length, and once it will come, resolution will be lost. So, I have to go more nearer. If I will stand here, then I will not see her, I will not see the wall, I will not see the ceiling, I will see only a screen. And if on my macula, if only a screen comes, that means resolution will be maximum. Do you know, this is the reason when you go to the cinema hall and if you buy the most expensive ticket, they give you the seat exactly 5 times to the diagonal length. If this is the screen and your seat is most expensive, 1, 2, 3, 4, 5, you are sitting here, and then you do not have to tilt your head, you are seeing entire screen in your macula. If you give little less money, or if you see on the book my show and all, the first seat which get booked is that point, that is 5 times to the diagonal length. And if you will not book it at that time, or if you want to spend less money, your seat is maximum back. In maximum back, your distance is more than 5 times. So, what happens? Image will come smaller. And another problem is you are not only on the screen, you are seeing the head of other people also, and you are seeing wall also, isn't it? So, that is why they switch off the light, so that you will not see, but then also you cannot enjoy that much. because you are more than 5 times. And if you will give very less money, they will just put you in front of the screen, so that a screen is too big for your eyeball also, not only macula, not only rods, even in the eye that much big a screen. So, sometime you are seeing here missing something, then you see this side then missing something, whole movie you have to keep on changing your neck, and you keep on changing the neck and you will not see the entire screen in one go, isn't it? And then you will get a headache, you will get the pain in the neck, and your show is bad. So, ergonomics is important even to watch a movie in the cinema hall. So, what is about laparoscopy? If I am too nearer, I am bad. If I am far away, I cannot operate better. So, always maintain your distance from the screen 5 times to the diagonal length. If you have a high definition monitor, your distance will be little more, because high definition monitors can project the image in bigger screen also. And if you have a standard definition, generally a standard definition image comes on 14-inch monitor better, because they have less pixels. So, in the large screen it will be blurred. So, the company they give a small screen, and a small screen you have to come nearer. Just like when you are iPhone, you are seeing the movie, you are keeping here, you are not keeping there. Or in the laptop, you are also keeping 5 times. Another important ergonomics is manipulation angle. These are few examples. Manipulation angle is, this is called as manipulation angle. Angle between two working instrument is called as manipulation angle, and manipulation angle should always be 60 degree. 60 degree. Whatever we do in our day to day life, we have better angle if you have 60 degree. He is writing right now, if you see his both the hands are 60 degree, her both the hands are 60 degree, angle between the hands. Even if you will play a keyboard, you play a drum, 60 degree sticks are 60 degree. Even if you clap 60 degree, even if you eat 60 degree. If I will tie your both the hand and then tell you to eat, your angles, manipulation angle is now 5 degree, and then you cannot eat, it will go to your nose. You cannot even eat ergonomically good if your manipulation angle is not 60 degree. In open surgery, we can make any time 60 degree, 30 degree, 15 degree. This is flexible because everything is open. But in laparoscopy, it depends upon your port position. Suppose this is a uterus or this is appendix, and I put one port here and one port here. Now, I cannot change my manipulation angle, and I will tell you I am putting one instrument here and another instrument there. This is one instrument here, and now you see with both these instruments my manipulation angle is approximately 120 degree. Can you see that? See this angle. This is not even 90, it is 120, isn't it? This is 120, because uterus will not move and my port will also not move. It is not open surgery that I can change the manipulation angle. Your manipulation angle depends upon your port position, and you do not know where to put the port. You put one wrong port, your manipulation angle is wrong, and now it does not matter how much experience, how much good you are surgeon or gynecologist, you are committed to do the mistake. You will damage the ureter, you will damage the uterine artery, you will struggle like anything. At the end of the surgery, you will cry that what happens today, I could not do anything good. How can you expect to do anything if your ergonomics is not good? You cannot write anything if I will tell you to write at 120 degree. It is not possible. Now, only option is you know where should be the port. That also unfortunately we do not know. You will ask your consultant why you are putting port here, they will say it is good. If you put the port here, you can do better. Then you will say why can I do better? Then no, it is good. Why it is good? No, no, it is good. This is not the rule. There is a rule there. There is a principle that is called as baseball diamond concept of port position. This is a discipline which you have to respect, and Do you know port position vary patient to patient? A uterus of a 6 centimeter and uterus of a 26 centimeter cannot have the same port position. Sometimes we want to copy the surgery of other and we want to remember the port position given in the book. In the book it is written it should be 3 centimeter medial and above the anterior superior iliac spine. It is good, but it is only good for 6 to 8 centimeter of uterus. That is a standard they have written. But in any of the book they have not described these principles also. They write and we remember 3 centimeter medial, 3 centimeter lateral, and then we apply there. But once the pathology size is changed, we are in trouble and we always make a wrong port position. And then we struggle. Once we struggle, second time we struggle, then we rethink and let us put little above. And then we know with our own mistake, we learn from our own mistake that okay, if I will put it here, then maybe probably I will be good. And then fourth or fifth case, we learn how to rectify. And then, but you don't need to do that. You don't need to do that. There is a concept of baseball diamond, concept of port position. There are few angles, there are few calculations, simple geometry, and anybody can make the port for anyone. A gynecologist can make the port for nephrectomy, for urologist. So anyway, so what I was speaking about, the manipulation angle. So if you will know the principle of exact mathematics, exact physics, then you don't have any problem. And after that, anybody can put the port for anyone. Because basically what is surgery? Surgery is dissection and tissue approximation. It does not matter which specialization you are doing. You are doing the same dissection and tissue approximation for uterus. He is doing for kidney, he is doing for gallbladder. We don't do anything extra, we don't put some salt or some spices there. We only cut and we seal and we suture. That is the surgery. So the basic ergonomics is same, just like driving a car. The skill of driving a car is same. And once you learn driving a car, it depends upon you how you want to use that car. Some of us, when we learn the driving a car, we use it for our bread and butter. I can work as a taxi driver. I can earn some money. And someone is using the same car for kidnapping also. Isn't? So, but the driving he will do also same. Instead of clutch, he will not press the brake for driving. So, laparoscopy is a skill. Once you learn the skill, after that sky is the limit. You can do any surgery you want. So, anyway, so this was manipulation angle. After comes elevation angle. What is elevation angle? This is elevation angle. Angle between the body of the patient, angle between the body of the patient and the instrument. This is should be 30 degree. 30 degree, 30. If it is more than 30 degree, you will cry. And if it is less than 30 degree, you will cry. And 30 degree is only possible if half instrument is in and half instrument is out. And you are 18 centimeter away from the target. Suppose this is appendix or uterus. If I am just above the target, suppose this is appendix, I have put the port just over McBurney point, then what is my elevation angle? 90 degree. If I am 10 centimeter away, it will be 60 degree. If I am 18 centimeter away, then it will be 30 degree. If I will go 24 centimeter away, it will be 15 degree. If I am more than 24, it will become 5 degree. Can you see that? So, your elevation angle depends upon your port position. And the best elevation angle in the world to perform anything is 30 degree. Even if you make a, pardon? That depends upon your length of your instrument. So, if normal is 36 centimeter, that is why 18 centimeter away. So, half instrument in, half instrument out, and your elevation angle will be 30 degree. Even if you make a, I will give a plate, a stove and an omelette. Even if you make an omelette, you can only make a omelette if your fork is at 30° angle. If it is 30°, suppose this is the omelette and this is your instrument. I will tell you, okay, you make the omelette, but keep always your fork 90°. Can you turn the omelette on other side? Never, you cannot lift it. But if I will give you 30°, you can go and you can make it like this. And again you can turn it this side, turn it that side. Even when you are eating with a spoon, with your rice, your angle of a spoon is 30°. If I tell you to keep a spoon at 90° and eat, can you eat? Can you lift any piece, any rice? Not possible. You cannot lift. But at 30°, you are going, you are taking rice and eating also. So, if you have to lift the tube, you have to see the ovary other side, you have to sweep the bowel, you have to retract the cecum. Your angle should be, elevation angle should be 30°. Then you can do it. Otherwise, you will cry, you will struggle like anything. Then comes azimuth angle. Azimuth angle is the angle between the instrument and telescope. Telescope is in the middle and the instrument. This vary from 15 to 45°. Azimuth, A-Z-I-M-U-T-H. This is called as azimuth angle. Azimuth, A-Z-I-M-U-T-H. Suppose telescope here rakho beech mein. Suppose this is the telescope here, you are keeping like that, hold it like this, and you are keeping the telescope like this. This angle is called as azimuth angle. Ideally, this is. So, ideally azimuth angle should be 30°. This side 30°, this side 30. Two azimuth angles make one manipulation angle, isn't it? Two azimuth angle is making one manipulation angle. But sometime, suppose inferior epigastric vessel is there, suppose sometime we do ipsilateral port position, then sometime one azimuth angle has to decrease. Now, this is 15°. If this is 15°, this has to become 45. And if this side is 20, then this side will become 40. So that ultimately manipulation angle should be 60. You got my? Ipsilateral port also. That I will discuss during the baseball diamond concept. We will discuss that what is the difference between the ipsilateral and contralateral and how to do the ergonomics of ipsilateral. Right now, I am just giving you the example so that to understand the principle, understand the importance. I am not discussing the ergonomics. Ergonomics every day we will discuss. For every surgery we will discuss separately, because laparoscopy means ergonomics. And once you discuss, then you are just like playing cricket. How you are holding the bat, how you stand, what is your timing, that depends upon, this is the difference in the player to player. Anyway, even the OT light should be 20 lux in laparoscopy. If it is that much brighted operation theatre, you will see the artifacts in the screen. You are seeing those lights. Can you see those lights on the screen? Every screen has some light. Light means these lights are, the picture of these lights are visible on the screen. Those are glares. And once the image also will come, those glares fused with the real image will make a optical illusion. And those optical illusion will change the anatomy and we will do the mistake. So, even OT light should not be more than 20 lux. This also makes a difference between the surgeon to surgeon. So, whenever we do something wrong in laparoscopy and we are not happy with our surgery, then we should think that where I have done wrong in the ergonomics, and you should try to learn it. It is not due to your problem, it is problem of ergonomics only. You may be very good. So, if you will reinvent, you rethink and next time do not do this, then your problem is solved. Or you ask or you see the book what they are saying for ergonomics. So, first pillar is, second pillar of minimal access surgery is task analysis. task analysis. Task analysis is very, very important. Task analysis means sequential steps of the procedural and executional task. Sequential steps of the procedural and executional task. What does it mean? Procedural means, suppose you have to do cholecystectomy. Then there are 5 procedures. What are the procedures? Procedure number 1 is access. Access means entry inside the abdomen with telescope and instrument. Procedure number 2 is exposure of Callot's triangle. Procedure number 3 is dissection of the cystic duct and cystic artery. Procedure number 4 is separation of the gallbladder from the liver, and procedure number 5 is extraction of the gallbladder out. Isn't it? This is procedure, 5 procedural steps. Exactly same way, hysterectomy you have procedure. First procedure is exposure of adnexa. Second procedure is dissection of the upper adnexal upper pedicles. Third procedure is separation of the anterior and posterior leaf of the broad ligament and opening of the UV fold. Fourth procedure is colpotomy, and fifth procedure is extraction of the uterus out. Sixth, you can add valve closure. Okay? This will never change. Everybody you know that, either you do by open or you do by laparoscopy. Procedure, you cannot do colpotomy without securing the uterine artery. Can you do that? You cannot do that. Nobody can separate the gallbladder without dissecting the cystic pedicle. Problem starts in cholecystectomy. There are 51 executional steps, and hysterectomy there are 91 executional steps. You have to write it in the course, and I will tell you also. 51 executional steps in cholecystectomy, and if you know less than 51, you are not complete surgeon. How can you claim that I can do cholecystectomy? You can never do cholecystectomy, because eye can only see which brain knows. Eye can only see the brain knows, and hand can only do the eye see. Hand can only do the thing where eye can see. So, brain should be ahead of eye, and eye should be in front of hand. Just like simple example, I will tell you to make a cup of tea for me. I went to your home, your wife is not there, and it is 11 o'clock at night, nobody can bring anything. Then you will think that, okay, I will offer a cup of tea to sir. So, how you will make a cup of tea? Just tell me.
Call someone.
No. You cannot call someone. Yes. Wake up. No, she is not there. Yes. So, he is giving you one clue, that first you have to search that all the ingredients to make a tea is available or not. Okay, that you will collect, it is available. Now tell, how you will make?
I will on the gas.
He will switch on the gas, he will put the water, he will boil the water, he will put the milk, then sugar he has told first. Okay, sugar, then milk, after that tea leaves, and then what you will do? Boil? How much time? Half an hour. Okay, he will boil and he will give it to me. Do you know that tea will be the worst tea which you have taken any care? Why? I will tell you. He did many mistakes because he don't know the task analysis. There is a chef who has written a book, 500-page book, how to make a tea. You have to read that book first. Making a tea is not a simple task. Of course, in that 500 page, 250 page he has written the history and the how tea was evolved, how British has developed the tea, how they marketed the tea all over the world. Those things are written, and then country-wise tea. Country-wise tea. Saudi Arabia flavor of tea is different. In the Afghanistan flavor of tea is different. In the Libya flavor of tea is different. In Turkey it is different. I have seen everywhere tea is different. And it depends upon the task analysis. Like what he did the mistake, he put the sugar first and milk first. Do you know, first thing, he should never put a sugar without asking me that how much sugar I want. Maybe I diabetic, maybe I will not take, or maybe I take a lot, or I don't take very less. So this is first mistake. Okay, anyway, this mistake is not that much big, but once you add the sugar and milk together, you will never get a good flavor of the tea, because a specific gravity of water increases after adding sugar and milk, and then from the tea leaf osmolar difference will not occur. The flavor and color it will not take. So, whenever you put water and tea leaf must be kept for some time alone, so that water can take the color and flavor of tea leaf. With the milk and sugar added, it will not take, because osmolar difference needs in the gradient, osmolar gradient. This is scientific. Temperature to add the tea leaf with the water is 60 degree. He has added the tea in the boiled water. Boiling water, if you will add the tea leaves, you will not get a good flavor. And he has boiled for 30 minutes. It becomes so bitter that nobody can drink it. So this is the task analysis which makes the difference in the flavor. That is why when you go to the 5-star hotel, they give you liquor, milk and sugar cube separately, so that you have to add your own, and if you do some mistake you cannot blame them, because our own mistake generally we do not tell anybody else. So you cannot say that your tea is not good, it has more sugar, it has bitter taste, or it has more milk, you cannot tell. So this is the meaning of task analysis. If you are doing any task, it should be scientifically programmed in a way just like ABCD. B should never be after D, it is wrong. If you have attempted the uterine arch without opening the anterior and posterior leaf of the broad ligament, you have a chance of damaging the ureter or not? You have it. What you did? Do you know, when you do LAVH, you should cut the round ligament 3 centimeter lateral. When you do TLH, you have to cut the round ligament 4 centimeter lateral. And when you do RLH, you have to cut the round ligament 5 or 6 centimeter lateral. This is the difference. Why? In LAVH, you do not take uterine artery, you take uterine artery from below, isn't it? So you do not need to go much lateral. In TLH, you have to go lateral, because lateral, if you will cut 4 centimeter and then open the anterior leaf of broad ligament from there, then you can reflect the peritoneum more lateral, and then ureter will go more. And in RLH, why you have to cut 5 centimeter lateral? Because you have to do lymphadenectomy also. So cutting the peritoneum this side medially as well as lateral, you will go to iliac vessels to remove the iliac lymph nodes. So task analysis is changed, like Turkish tea, Egyptian tea, and in India tea means sweet drink, a lot of sugar. First he has added sugar only. Without sweet tea, tea does not have value here. And here India also, South India flavor of the tea, North Indian flavor of the tea. In North India they use gold dana, they do not use the tea leaves more. In South Indian they do not take those they take pure leaf, and the flavor of both is different. So this is the flavor of surgery, which depends upon your correct task analysis. These 26 words are making millions of words due to the sequence how it was programmed, and this you have to learn in laparoscopy. Just like you told, cholecystectomy you have the problem because your executional steps are less, it is not 51. You have to fill up the blanks where you are. Just like sometimes what we do, we learn laparoscopy by seeing the YouTube videos. Unfortunately, those are edited videos. Wherever we do bleeding, we cut that area and paste it from. And do you know how those videos are? A, B, C, D, E, F, L, M, N, O, P, X, Y, Z, and all the letters are missing. And we think those missing letters, we do not put it our surgery, and then we come complication and accident is waiting to happen. So those videos are useless to learn laparoscopy. You have to learn the complete sequential task analysis, properly programmed 1, 2, 3, 4, 5, 6. and each and every step. The surgeons who do the exact task analysis, they never have the problem, and the people who are jumping from one step to another without having the gap in between, they have a lot of fill up the blanks, and those are the blanks where there is a possibility of complication. This is the meaning of task analysis. In open surgery, you do not need much, because in open surgery task analysis, half of the task is done by your assistant who is standing on the opposite side of table, and open surgery has spoiled us. Open surgery, do you know, most of the open surgery in most of the medical colleges are done by the assistants. I am not joking. If you see most of the medical colleges, some of the OT technicians, some of the lab boys are so trained OT assistant that without them you cannot perform surgery. You call them that Falana ji chaliye aaj humko karna hai ek surgery, please come, I have to do one surgery, and they are the real surgeons. They help every surgeon. If you do not have a assistant of your choice, you will postpone the surgery for few hours, that let him come, he has gone somewhere. You will not tell any other nurse that come, I will do the surgery, because 50% of the work is done by the assistant who is standing on the opposite side of table. Unfortunately, minimal access surgery, we are handicapped, we are blind. Our left hand is assistant, right hand is surgeon, and camera person is doing. And if you do something wrong, bleeding has started, everybody is smiling in the room. They cannot help you. They can only pass the critics, because everybody is seeing what you are doing. So, in laparoscopy, you have to be 100% accurate in the task analysis. Third pillar is engineering. Engineering, generally doctors are not good engineers, and their mathematics and physics is very bad. That is why you are doctors, otherwise you would have IIT and engineers. Doctors, they focus more in the biology, isn't it? And their physics and mathematics is weak. So, whenever these engineering parts come, we want to ignore it. Let us forget it. This is the nurse job. This is the nurse job. This can work in open surgery. This never work in laparoscopy. You have to go deep into the engineering. Do you know, if I will tell you about the camera, most of the people, what they know about the camera? What you know about the camera is only how to switch on, switch off, then you know white balancing, and then you know focusing. That is all. Nobody is knowing anything else. Do you know camera? I will discussing the camera takes 2 hour time. Camera has aperture, camera has fibroscope filter, camera has shutter speed, camera has R gain, blue gain, green gain, camera has a different type of window, and what other else, and you have to adjust. The good cameraman, with the bad camera also they can take good picture, because they can adjust the shutter speed. If the light is more, shutter should be slow. If light is less, shutter should be slow, and light is more, shutter should be fast. Shutter means amount of time which you are exposing the light to the camera. Aperture is also adjusted. Fibroscope filter, if you are doing hysteroscopy, you will not use the same setting which you are doing in laparoscopy. The setting will change, and then you have to use accordingly. Every surgery has a different, just like if you are buying an iPhone, and if you have a only 3000 rupees phone, then the technology is different. And if more expensive camera you will buy, like HD camera, 3 chip HD camera, it has more setting, it has more programming, and you have to learn it. Without learning you cannot escape, you cannot. Most of the time what happens, if the image does not come good, we tell nurse, and the poor nurse comes, she tries to fix something, you yourself does not know anything about the technology. Exactly same way insufflator. Insufflator has quadromanometric indicator. It has a 4 important reading: preset pressure, actual pressure, flow rate, and total amount of gas used. And there are few calculation of these 4 readings, and it will exactly within 5 seconds after putting the venous needle, it will tell you where the gas is going. It is going in vein, it is going in artery, it is going in bowel, it is going into the preperitoneum, or it is going into the abdomen. Exactly 100% accurate insufflator will let you know. But generally we do not have any idea, we keep on palpating the abdomen and assuming it has gone or it is not, it is gone, it is not, because nobody has told about the ergonomics and the engineering aspect. Nobody told. Energy sources, you are doing the monopolar, you have direct coupling, capacitive coupling, insulation failure, you have different type of AEM technology, that is active electrode monitoring system. You have the blend current, you have fulguration, you have the spray, you have desiccation, and which type of current will be used for which tissue need how much wattage of current, we never know. We think that using the energy means burning the tissue. Otherwise, someone has maximum told you that okay, whenever you see that it started boiling, that means it is cooking. What is this? You are not a cook in the kitchen that you will see the boiling and you will not touch that this rice is cooked or not. You have to know the engineering behind it. At which temperature elastin will coagulate, at which temperature the collagen will melt, which temperature is for sealing, which frequency is for cutting. So, this is engineering. So, engineering part once you will learn, you will get a lot of confidence, and then you will not have to depend upon anyone. Even you can ask the instrument company also, and like you bought one generator. You know, electrosurgical generator should have minimum 500 kilohertz to maximum 3.3 megahertz frequency, and which frequency you are buying depends upon how good you can do the surgery, which tissue want which frequency of generator. So, these things are also very important. Even connecting the cable from camera to the monitor, you have HDMI, you have a DVI, you have a S video, you have composite, which cable I should connect, how should I record the video? Every video you have to record, and nowadays every patient they ask that give my DVD, laparoscopy. So, you have to learn the video editing also. In our diploma we have the training of video editing and movie making, because if you will not know how to edit the video, you give raw video to the patient and patient will see and he will cry, oh God, doctor has taken all my blood out. And even after 10 years they will say, I am weak because during surgery my blood was drained. Their blood never get again replaced in whole life. So, you need to do how to increase the speed of video, how to cut those important part, how to do the editing, how to put the voice over, and then you can make a beautiful video. You can high definition, you can give to your patient, you can upload to the YouTube, you can present in the conferences also, isn't it? So, those engineering part also you have to learn. Then you should how to attach the different recorders, which cable I should attach, how to transfer those data to your laptop. And do you know, once you will learn, it is only 10-minute job. Once you not learn, you cannot do in 1 week also, because training is required, and once you are trained, it is your quickly you can do. You can make a project, and in that project you can keep on putting all the other videos also. Your project is already once upon a time it is made and then it is saved in your computer. Now, you have to just add the main video and reproduce your video within 10 minutes. So, these are the 3 important pillars, which without that you cannot become a complete laparoscopic surgeon. And everywhere you have a problem, you should ask that where my ergonomics is wrong. Do you know, these all sessions are for your work, and you have to work here, you have to work many times, many things you will learn, and wherever you are having problem, you should ask about the ergonomics. We will keep on watching you and we will correct your ergonomics, but if you are struggling yourself, you should not hesitate and you should ask us. Me, Dr. Chauhan will be also there, then we will help you to find out that where is the problem with the ergonomics.